Now the thigh. Thigh is a part of the lower limb between the hip and the knee joints. The thigh is divided into three regions: front of thigh, medial side of thigh, and back of thigh. We will be discussing the front of the thigh. Now the superficial fascia of the front of the thigh near the inguinal region consists of two layers: thick superficial fatty layer and deep membranous layer, which are continuous above with the corresponding layers of the anterior abdominal wall. Now this superficial fascia on the front of the thigh contains cutaneous nerves, cutaneous arteries, termination of saphenous vein and its tributaries, and superficial inguinal lymph nodes. Now skin on the front of thigh is supplied by 7 cutaneous nerves, which are derived from the lumbar plexus: Ilioinguinal nerve, femoral branch of genitofemoral nerve, lateral cutaneous nerve of thigh, intermediate cutaneous nerves of thigh, and medial cutaneous nerve of thigh. Besides, we have saphenous nerve and cutaneous branch of obturator nerve. Now this ilioinguinal nerve is a collateral branch of the iliohypogastric nerve. It emerges from the superficial inguinal ring and supplies the skin at the root of penis and anterior 1/3 of scrotum in males and mons pubis and anterior 1/3 of labium majus in female, and skin of the upper medial aspect of thigh. The femoral branch of genitofemoral nerve pierces the femoral sheath and overlying deep fascia 2 centimeters below the mid-inguinal point and supplies the skin over the femoral triangle. Now this lateral cutaneous nerve of the thigh is a direct branch from the lumbar plexus. It enters the thigh by passing behind or through the lateral end of inguinal ligament. It supplies the skin on the anterolateral side of the upper thigh. Now this lateral cutaneous nerve of the thigh is sometimes compressed as it passes through the inguinal ligament, causing pain and paresthesia in the upper lateral aspect of the thigh, leading to a clinical condition called myalgia paresthetica. Now intermediate cutaneous nerve of the thigh is a branch of the anterior division of the femoral nerve. It passes vertically downwards and pierces the deep fascia at the junction of upper 1/3 and middle 1/3 of the thigh. It divides into 2 or more branches and supplies the skin on the front of the thigh. The medial cutaneous nerve of the thigh is a branch of the anterior division of the femoral nerve. It divides into anterior and posterior branches which run medially across the femoral vessels and pierce the fascia lata at mid of thigh and supplies the skin on the medial side of the thigh. Now this saphenous nerve is a branch of the posterior division of the femoral nerve. It pierces the deep fascia on the medial side of the thigh and runs forwards in front of the great saphenous vein. Cutaneous branch from the obturator nerve is a small twig which arises from the anterior division of the obturator nerve and supplies the lower one-third of the medial aspect of the thigh. So these were the cutaneous nerve supply of the front of thigh. Now what is patellar plexus? The patellar plexus is a plexus of nerves present in front of the patella, ligamentum patella, and the upper one-third of tibia, and supplies the skin over these structures. It is formed by branches from the lateral cutaneous nerve of thigh, intermediate cutaneous nerve of thigh, and medial cutaneous nerve of thigh, and also by the infrapatellar branch of the saphenous nerve. That is the patellar plexus. Now cutaneous arteries. There are three small arteries arising from the femoral artery. The superficial external pudendal artery arises medially from the femoral artery, pierces the cribriform fascia, runs medially in front of the spermatic cord and supplies the external genitalia. Another is the superficial epigastric artery. It arises anteriorly from the femoral artery, pierces the cribriform fascia to ascend anterior to the inguinal ligament and runs towards the umbilicus. It supplies the lower part of the anterior abdominal wall. Another is the superficial circumflex iliac artery. It arises near the superficial epigastric artery, pierces the fascia lata or the deep fascia of the thigh lateral to the saphenous opening to run upwards and laterally below the inguinal ligament. Now long saphenous vein, it is the largest and longest superficial vein of the lower limb. It begins on the dorsum of the foot from the medial end of the dorsal venous arch, runs upwards in front of the medial malleolus and ascends on the medial side of the leg. It enters the medial aspect of the thigh by passing behind the knee. In the thigh, it inclines forwards to reach the saphenous opening, where it pierces the cribriform fascia and opens into the femoral vein. Before piercing the cribriform fascia, it receives three tributaries, that are the superficial epigastric vein, superficial external pudendal vein, and superficial circumflex iliac vein. Now another structures which are present in superficial fascia are superficial inguinal lymph nodes. The superficial inguinal lymph nodes are variable in their number and size. They are divided into two sets, horizontal group and vertical group. The two sets are arranged in T-shaped manner. The nodes of the upper horizontal set, 5 or 6 in number, are located a short distance below the inguinal ligament. The nodes of this set can be divided into upper lateral and upper medial groups. The nodes of the lower vertical set, that are 4 or 5 in number, lie along the upper part of the saphenous vein. The efferent Lymph vessels from the superficial inguinal nodes pass through the saphenous opening and drain into the deep inguinal nodes. Now deep fascia of the thigh. Deep fascia of the thigh is very strong and envelops the thigh like a sleeve. It is called fascia lata because it encloses a wide area of thigh. Modifications of deep fascia. The deep fascia of the thigh presents two modifications, that are the iliotibial tract and saphenous opening. Now this saphenous opening, this is an oval opening in the fascia lata or the deep fascia of the thigh in the upper medial part of the front of the thigh. The center of the opening is about 4 centimeters below and lateral to the pubic tubercle. Its vertical length measures about 3 to 4 centimeters. The opening is bounded inferolaterally by a sharp crescentic margin. It is formed by the superficial stratum of the deep fascia, which lies in front of the femoral sheath. The medial margin of the opening is ill-defined and is formed by the deep stratum, which lies at a deeper level and becomes continuous with the fascia overlying the pectineus. It lies at a deeper level. The saphenous opening is closed by a membrane of areolar tissue that is known as cribriform fascia, which is pierced by a number of structures, making it sieve-like. Hence, it is known as cribriform. The structures which pierce the saphenous opening are great saphenous vein, superficial epigastric and superficial external pudendal vessels, few lymph vessels connecting the superficial and deep inguinal lymph nodes. Now another modification of the deep fascia of the thigh or fascia lata is the iliotibial tract. This iliotibial tract, it is a thickened fascia lata on the lateral aspect of the thigh to form about 2 inches wide band that is known as iliotibial tract. Superiorly along the iliac crest, this tract splits into 2 layers to enclose the 2 muscles that are the tensor fascia lata and the gluteus maximus, and forms a single thickened sheath between these 2 muscles that is known as gluteal aponeurosis between them, which covers the gluteus medius muscle. The superficial lamina is attached to the tubercle of the iliac crest, and the deep lamina of the iliotibial tract is attached to the capsule of the hip joint. Inferiorly, this tract is attached to the smooth area on the anterior surface of lateral condyle of the tibia. Now its significance is that it stabilizes the knee both in extension and in partial flexion. Hence, it is used constantly during walking and running. Now, facial compartments of the front of the thigh. The fascia lata encloses the entire thigh like a sleeve. 3 intermuscular facial septa, that are the lateral, medial, and posterior intermuscular, Septa pass from the inner aspect of the deep fascial sheath of the thigh to the linea aspera of the femur and divides the thigh into three compartments: anterior, medial, and posterior. The anterior compartment, that is also known as extensor compartment, lies between the lateral and medial intermuscular septa. The medial compartment, that is also known as adductor compartment, it lies between the medial and posterior septa, and the posterior or flexor compartment lies between the posterior and lateral septa. Each compartment contains the muscles, nerves, and arteries. The lateral intermuscular septum is the strongest septum. It extends from the iliotibial tract to the lateral lip of the linea aspera, while as medial intermuscular septum is attached to the medial lip of linea aspera. The posterior intermuscular septum is poorly defined.